A new virus that's already killed more than 24 people has health officials very worried right now. It is, in its full name, the Middle East Respiratory Syndrome Coronavirus, shortened to MERS. It's in the same family of viruses as SARS, if you remember that scare. It first surfaced a year ago in Saudi Arabia. So far, all the people who've contracted MERS were infected in the Middle East. The original source of the infection and how it spreads is still a mystery. I'm joined now on the phone from Riyadh by Dr. Abdullah Asiri. He's the Director of Infection Prevention for the Saudi Health Ministry. Thank you for being with us, Dr. Asiri. First of all, what do we know about how this virus is contracted and how much at risk people might be in Saudi Arabia, for instance, of catching this virus?
Yes, thank you for having me. The current information states that the virus is probably started as a community case, and then there was a secondary transmission inside healthcare facilities. So there is an evidence that it can be transmitted from direct contact with infected patients, and people who are more likely to get the infections are those in the extremes of age and with comorbidities like chronic illnesses, especially renal failure. So there is,
I was going to, sorry, go ahead.
There is no evidence of community transmission at this moment. All the cases that have been announced in the last 2 weeks were related to in-hospital transmission.
So you're saying there's no cases of transmission outside of the hospital environment, is that correct?
There were 3 cases that were inside families of infected patients, but this was in the mid-April. But in the last 3 weeks, there was no single case in the community. All cases were recorded inside hospitals.
So 49 cases total, and it's a very wide geographic area. Should we come to the conclusion then that it is not spreading quickly, and in that sense, that is good news?
That's right. I mean, it needs a very profound and direct contact with infected patients to contract the infection. Mm-hmm. And immediate family members are only at risk if they are in close vicinity to the patient for an extended period of time, not the casual contacts. And that's what we have noticed up till now.
I see. But then when I look at the statistics, I see 49 cases, but 27 deaths. In other words, quite a lethal virus, this one.
Yeah, it's a bit of a bias because we are only testing people who are actually in the hospital with pneumonia. And these people tend to have the severe form of the disease. Now, we did not extend our investigation to the community, to the family members who are not showing severe symptoms. So we are only testing the very severe cases, and they are more likely to have a lot of chronic diseases and more likely to die from any infection, even if it's not as severe as the current infection.
So there might be a statistical bias there because not all cases are reported as coronavirus cases. But lastly, people watch us all over the world, Dr. Asiri. And they might be wondering if, if I need to travel to Saudi Arabia for whatever reason, that part of the world, should I be concerned or not?
No, I don't think we should have any concerns about travel from and to Saudi Arabia at this moment. And this is what the WHO is agreeing with us on this point. The transmission is still very limited and is geographically constrained. So I don't think we should take any drastic at this moment.
Right, and there are no advisories or anything asking people not to travel for any health reason. Dr. Abdullah Asiri, the Director of Infection Prevention for the Saudi Health Ministry, thank you very much for joining us on CNN today.